Kaylin Lur. Good afternoon, everyone. Welcome to Nashville General Hospital's Wellness Wednesday Facebook Live program, highlighting Men's Health Month. Thank you for joining us today. I'm Kathy Poole.
And I'm Kaylin Harris. Our goal of Wellness Wednesdays is to introduce you to Nashville General Hospital experts, have them share information vital to your health and wellness, and give you the opportunity to ask questions during their presentation. Joining us today is Dr. Kevin Billups, who leads the Men's Health Center at Nashville Healthcare Center, Midtown, and is a professor of medicine and urology at Meharry Medical College, as well as being the director of their men's health program.
Dr. Billups has dedicated his career to men's health and sexual medicine for the past 30 years. His life's goal is to empower men to transform their health and proactively act to prevent chronic medical conditions such as diabetes, high blood pressure, heart disease, obesity, and depression, all of which are major contributors to suffering and early death. He received his medical degree from the Johns Hopkins University School of Medicine in Baltimore, Maryland, and his undergraduate degree from Harvard University. Dr. Billups completed a residency in urology at the Johns Hopkins Brady Urologic Institute and completed fellowship training in sexual medicine, male infertility, and vascular biology at the University of Virginia in Charlottesville. Everyone, please welcome Dr. Kevin Billups.
Thank you and welcome everybody. I'll go ahead and I'll bring up my presentation now, but okay, there we go. Can you all see that? We good?
Yes.
All right. Okay. Well, good. So, great to be here and happy to share this information with you, especially around at the time of Men's Health Month. So, Kathy gave you kind of the academic side of me. I'll tell you a little bit about my own story, because the things I'm going to be talking to you about are things that I've kind of experienced. So I'm going to talk about men's health. I'm going to really talk about my approach to men's health and talking to men. Tell you a little bit about what's new and what's interesting. So we're going to talk a lot about some of the things that help men. But it's interesting. As men, we tend to delay taking care of ourselves. We aren't very good about that. And honestly, I was no better than anybody else. And I had reached a point about 7 years ago in my life where just overworked, stressed out, had put on a lot of weight. And like a typical man, I managed to put off and justify how I really wasn't feeling. The fact I was feeling bad wasn't a big deal. And I could manage all of this. And finally, had my blood pressure and stuff taken. So my blood pressure was up. My cholesterol was up. I had signs of what they call pre-diabetes, and I was just exhausted and not feeling well. So even at that stage, I managed to go into a little bit more denial. And finally, a friend of mine said, "You should come, and I want you to come and go to this meeting where we're going to talk about lifestyle changes that you can make and impact your overall health." And I didn't want to go, but I forgot how he tricked me into going. But he got me in there. And I listened, and the work was what was being presented was so compelling that I came out and said, "Hey, I got to get all my guys on this kind of a plan." And my wife just kind of pulled me aside and said, "Look at the way you're eating and what you're doing. How can you do anything?" And so I took that challenge, and I went ahead and change. So the things I'm going to be talking about are things that I've kind of been through. And I'll tell you, as skeptical as I was, over the course of about 4 or 5 months, I dropped like 40 pounds. I felt better. I was sleeping better. Everything was better. And I did it cold turkey, which I don't necessarily recommend, but I did it because I was skeptical and I wanted to get back to my usual lifestyle. And long story short, I couldn't. So I'm going to talk a little bit about how we can look at achieving optimal health and performance as men. So if you look at men, a couple things just in general, we die earlier than women. So, on average, about 6 years early. If you look at African-American men, we'd almost die almost 10 years earlier than men. I can tell you that a lot of the deaths and things that we see with men are a premature deaths, deaths in the prime of life. A lot of them are preventable. And I have down there at the bottom, as men, we take better care of our cars than we do ourselves, right? And I think every man and probably every woman, I always get a smile when I say that, because one, it's true. If the check engine light in our car goes off, we will get that car in so fast and make sure it's still going on. Well, I'm going to talk to you about some symptoms that as men we have that really are the check engine light for our body going off, that are going off, and we usually ignore them. So these are the symptoms. These are the most common symptoms I see that bring people into my men's health practice. My practice has been limited to men's health for probably the past 25 or 30 years. This is a partial list of symptoms, but these are the most common. So you have erectile dysfunction, and the real symptom there is that you can't get or keep a firm erection. You lose it too quickly. You just don't get a good erection. That's erectile dysfunction. The poor sex drive there, decreased libido, low energy, those are usually signs of low testosterone. Weight gain. A lot of men come in because they're concerned about gaining weight. Arthritis, gout, so all kind of pains, right? You can have knee pain, you can have back pain. Gout is a pain usually in your toe, one of your big toes. That brings a lot of guys in. Pick up a lot of men who have a depressed mood. So either they're depressed, maybe, or they have chronic stress, chronic anxiety, acid reflux, sour stomach. A lot of guys coming in with that. Low back pain, certainly urinary symptoms, right? I'm one being a urologist, but just in general, urinary symptoms will get a man's attention. And then snoring. Snoring is another important thing because it can be linked to sleep apnea. So I'm going to give you one example of how a symptom that a lot of guys are probably ignoring is important. So I'm going to take erectile dysfunction because that's a lot of my practice. And I'll tell you a story, a true story about a patient. I'm obviously not going to use his real names. I'm going to call him Mr. Smith for this. But Mr. Smith was about 50 years old, and he was having some problems with his erection. So he actually was having problems keeping a good erection. He would lose it too quickly. And he honestly wasn't that bothered by it, but his wife kind of said, you need to go in and do something about it. So when the time he got in to see me, he hadn't seen a doctor for several years. He hadn't been followed up with his primary and things like that. So I came in and I talked to him. He had the history of erectile dysfunction. He also was overweight. So when we really checked him out, he was overweight. His cholesterol was up. He had pre-diabetes. And then he also had this kind of shortness of breath issue going on. So it was a lot going on. And I was concerned enough, and I said, look, I think you need to go over and actually see one of our preventive cardiology folks, because you're young, but you have all these risk factors, and you got this shortness of breath. And to make a long story short, he was evaluated, and he was found to have 3 areas of blockages in his heart. So we caught him early. He ended up having an angioplasty, did fine. Of course, I fixed the erectile dysfunction after that. But the point I want to make is, the symptom of erectile dysfunction, and here's something in the literature, because everything that I talk to you about will be evidence-based. In the literature, if you're a man between 40 and 49 years old, and you have erectile dysfunction, you have a 50-fold increased risk of having a heart attack or a stroke over the next 10 years than if you don't have erectile dysfunction. So it is an early warning sign that a lot of men ignore, especially at that early stage where you're just not able to keep a good erection. But this was a perfect example of picking somebody else up early. And I'm gonna tell you, that is not an uncommon story. I hear that all the time. And unfortunately, a lot of times I hear about it after the heart attack, after they've had that, when they come in and I talk to them and they say, well, I was having this symptom, a few years ago. So this is the key takeaway slide for what I'm going to talk about, the key point. If you remember nothing else I say, remember this, right? Men's health and metabolic health. So metabolic health sounds like a fancy term. It is not a fancy term. It's only 4 things. I call them 4 pillars of metabolic health. So what's your blood sugar, what's your waist size, what's your blood pressure, and what's your cholesterol. So why are these important? These are important because 88% of men have an abnormal profile. That's just one of these that's abnormal. the reality is the guys I see when they come in my practice, they have 3 or 4 of these that are off. So if you look at these numbers, your blood sugar when you're fasting should be less than 100. Your waist size, this is at the belly button. Okay, all the guys, we all want to give our pant size. Pant size doesn't count. It's at the, you got to get a tape measure. You can do that right now. Get a tape measure, measure yourself at the belly button, and it should be less than 40 inches. You know, we talk about pinching an inch. Well, this poor guy is pinching about 5 or 6 inches. So, you know, we don't want to get there. That belly fat is a bad actor. You see your blood pressure numbers there. That's an optimal blood pressure. And I only put the bad cholesterol there, the LDL that should be less than 100. Now, as I said, when the typical person I'll see in my practice will have 3 or 4 of these things that are wrong. And when I think back on where I was about 6 or 7 years ago, I think I had all 4 of these that were off, you know, and I thought, I thought I was doing well. I was actually in denial that I was doing well, but that's where a lot of us are. But the good news is, you know, we can correct this. Before I give you some more good news, let's look at what happens. So the symptoms lead to this metabolic health. The symptoms are a manifestation of what's going on. So if you look at this slide again here, when you have those symptoms, I know I'm going to pick up some of these things that are abnormal. Now, what happens is if you ignore this, is that you end up having these problems. So let's look at heart disease or hypertension. If you look at that, about 50% of the men listening to this call will have high blood pressure and some form of heart disease. If you look at diabetes or pre-diabetes, about 50% will have this. So 50% of the men listening to this, or actually the adults listening to this, have that. 75% of us listening to this Zoom call are overweight or obese, and about 40% with high cholesterol. I put cancer down there. I could also put depression, stress, and anxiety. That's going to account for about 25% of people having these. So there are real outcomes to these conditions. Now, the good news is that everything I've mentioned to you is directly related to nutrition and lifestyle. So we really have it within our own capability to directly impact all of these conditions. You know, you can have a family history and you can have bad genes, but you can't blame bad genes for your complete outcome, right? We have a lot of control over our own outcome and our environment. So here's some good news. The solution is you can get healthier. You can impact that. Now, of course, you know, do you need you may need medicines, and certainly you know that's very true. But whether or not you're on medicines or not, you can impact a lot just by lifestyle changes to kind of level set and take care of these metabolic conditions. Now, here's some good news. You can change your metabolic health profile that I just spoke about. You can change it within 4 to 6 weeks. And actually, it's earlier than that. You know, I mean, I know that within 2 weeks, if you change the way you eat and your lifestyle, that you can make a difference. By 4 to 6 weeks, we're seeing changes in your blood pressure, your cholesterol, your waist circumference, and everything. So really, you do have this. You do have this this capability in terms of doing this. Now, before I go into so actually I'll go here next. So here's a conversation that I have with men, because I'm going to tell you about a program that actually one of my patients developed, who was just like me, had these challenges, and we put together, we call it a 90-day challenge. But here's the conversation, here's the questions that I'll ask somebody after I've taken the history and talked and spoken to you and kind of got to know who you are. I'll ask you 2 questions. And the first one is, are you curious or are you serious about your health? That's the first thing I'll ask every man in the practice. And most of the guys are going to say they're serious because you're in the doctor's office and you're not going to back down because we're men. So of course we're going to be serious. You know, at that point, you're not going to back down. Then the second thing I'll say is, are you willing to face the things that are making you sick? And if you say yes to that question, I'll say, all right, good. Because if you're willing to work with me, I can tell you that not only can I improve your overall health, but I can actually transform and change your life. And how do we do that? Well, there are kind of 4 components that I found to be really important in, you know, when we look at integrating lifestyle. The first one is the mindset. The biggest thing, honestly, is that the men have to be ready to make a change. You have to be what I call sick and tired of being sick and tired. So you're actually ready to make that change. I had reached a point where I was like, I am ready to make a change. I don't like the way I'm living. I don't like the way I am feeling. So mindset is huge. Then getting medical IQ, or a better word than IQ is actually medical knowledge, getting knowledge about medicine, getting knowledge about nutrition. So you understand why, if you eat differently, you can change all those parameters that I talked about. And then we're talking about movement, and also sleep is important. These kind of four things, and we package this into a 90-day process where we can we can walk you through, and the guys go through this program, and we have a communication with other men. It's virtual, and what I'll tell you is it's been extremely effective in terms of getting results. So I tell all the men coming through, look, if you will level up around lifestyle, then I can help you get where you need to go. And we're getting men, off of some of their medications for diabetes, high blood pressure, cholesterol issues, and things like that. But more than that, we're getting guys that feel better. We don't focus on weight loss. I tell you, if you manage those metabolic health problems, the weight loss really just kind of, the weight comes off by itself, honestly. So we don't even focus on that, and we don't have to. And, I think I'll stop there so I can get questions that are coming in. So I'll stop sharing there. And, but the point I wanted to give you was really just kind of what I think is, it's a different approach to men's health. That's what we're trying to do here. But it's a very effective approach. And I always end by, because people always say, well, I don't have time, and this and that. And I say, okay, let me introduce you to a term called COI. And COI is called the cost of inaction. COI. So what's the COI if you don't make some changes? Well, the COI is, you might be one of the people like Mr. Smith who ends up with a heart attack or a stroke. Maybe you get caught early. The COI is that you might become both an economic and an emotional burden on your family if you get one of these conditions. The COI is that you might die early and leave your most productive years on the table. So there is a cost of inaction for not doing this. And our goal is really like, let's not get to that point, right? I mean, let's not wait until we get sick. Let's switch to what I call a first mile of care mentality, where why don't we try and live a thriving life where I won't get sick? And if you do get sick, let's get rid of it and then not have it come back, as opposed to let me get sick and figure out what we can do. So I'll stop there and be happy to take any questions.
Well, thank you very much, Dr. Billups, for all of the timely information that you shared today in your presentation. So for anyone that is watching us in the digital and the virtual world, please know we are accepting questions that you may possibly have through our Facebook account. So you can comment in the chat at Nashville General is how you find us. So we do have a question here now. How can we get men past the white coat syndrome?
So getting men past yes, that's a good question. That's a tough question, because all of us hate going into the doctor. And I also know that when I go into the doctor myself, my blood pressure is always higher. And I'm a physician, and I still, it just goes up because of that. So I would say there are a couple ways. One I found is that when men are really educated on the fact that we can actually do a lot on our own in terms of changing our lifestyles to make ourselves healthier. When you understand that some of this blood pressure and things like that are linked to being overweight, just being out of shape, things like that, you can do that. The other thing I recommend to a lot of my patients is you should have your own blood pressure cuff and monitor yourself at home, right? Because it's a much better indicator to me if you come in and say, I check my blood pressure a couple of times a week in a certain setting, and it runs at this level when I check it. And then if you come in and it's higher. So I think some of it has to be just education. Some of it has to be, as men, that we just got to learn we've got to take more responsibility, take better care of us. And like I said, I'm as as anybody. So I'm not even going to point because it's our nature. But I think things are changing over the past 5 years. I've seen that men are more proactive. Women can play a very important role. You can help us to come in, one by just trying to be the voice of reason, and then ultimately you may just have to be the voice of, get in now, or or I'm not speaking to you. So those are some ideas I have on what to do. A very common problem.
Thank you. Thank you very much, Dr. Billups. Okay, we're waiting on more questions to come in as we speak, but I'll hand it over to Kathy while I monitor the chat.
Well, one of my questions is how do we, as women, this is an important message as well. This, although it is Men's Health Month, it's important for us to hear it so that we can have these conversations with our husbands or our fathers or, anybody, to be able to jump in and say, hey, I heard Dr. Billups talking, and maybe you do need to go ahead and see him, because it is concerning when you were saying from 40 to 49, if men are experiencing ED, that's an indicator of something that could be much more serious. So
Yes.
what is your average age of patients, or what does your typical patient look like?
Sure. So the typical patient in my clinic, I say the age range runs from, say, 40 to 65. Now, I see plenty of men between 65 and 75 too, but a lot of it, and I'd say the average age is probably a guy in his mid 50s. But even if you take that 40 to 65 range, so, come in, I'd say really on a lot of the guys overweight, maybe not obese, but overweight, usually 2 or more chronic health challenges. It might be high pressure, you might be a little overweight, diabetic or pre-diabetic. A lot of guys coming in early on with pre-diabetes. So that's kind of what I typically see. Now they may come in, say, for erectile dysfunction, or they're feeling tired, or they think it's low testosterone. The first thing I'll say is having erectile dysfunction, low testosterone, that doesn't happen in a vacuum. I can guarantee you, if you're coming into me, for the most part, with one of those conditions that are a little more noticeable for us, that those 4 things I mentioned, the metabolic health parameters, blood pressure, blood sugar, cholesterol, and your waist size, the belly fat, you're going to have 2 or 4 of those, 2 of those that are abnormal. So some of this is just education. When we tell men, and the women can do this too. It's like, okay, you have erectile dysfunction, you think it's embarrassing, it's an attack on your manhood. Well, that's not really the point. The point is 2 things. One is there's an underlying reason why you have this. So it really is no different than having diabetes or high blood pressure. Rather than just go out and get a pill online or get a pill from your buddy or do something like that, that's just masking a symptom of an underlying problem. Get the underlying problem taken care of. The symptoms, I can tell one stories about guys who've gone through with the lifestyle and they've gotten all their blood pressure, blood sugar under better control. And they're like, oh, lo and behold, something else works better too. And I'm like, I'm not surprised, because it's all linked to your metabolic health. But I think those are things where women can play a very important role in being encouraging, coming in with the initial education. In the lifestyle program we have, a lot of times the women will actually go through the program with the men, because those metabolic conditions I mentioned, honestly, they affect men and women, right? We're all prone to those. So, so a lot of times people kind of get on this journey as couples, and that's been very promising too.
Perfect. So we do actually have a question that came through on the Facebook Live chat. How can we get providers to understand? How can we get providers to understand that most patients don't have a high level of literacy in regards to healthcare? Most patients don't understand medical terminology.
Yes. So not understanding. So that's another great point. I think some of it is, as a provider, you have to learn to talk in plain language. So I mean, that's something that I think some of it is you can be taught, and some of it is you're just wired that way, so you understand. So one of the but your point is very valid, that if you don't talk to patients in a way that they can understand, I mean, you don't want to make it like so simple, but you want to make it so, look, this is really what you need to know. I don't know if you all listen to Joe Madison. I love listening to Joe Madison on Sirius Radio, and the term he uses is put it where the goats can get it, right? I mean, just put it where if you're literally if you're in elementary school or what, you understand what I'm saying. So my best advice there would be you should seek out that kind of provider, right? And if your provider isn't saying that to you, I think the one thing you can say is, can you just explain that in terms that I can understand? You know, you can bring that up. And then if you still have somebody that just can't do it, I would say you need to find somebody that can. So that's something that I kind of pride myself on to do, is really just being able to have a frank conversation, but it's in terms that we all understand, and then get questions to go from there. So that's what I would do.
Thank you, Dr. Billups. Thank you. And I do want to ask, as a follow-up to Kathy's question, I know that you spoke about what your average patient, looks like by target audience and demographic base, but when would you recommend that an individual come and see you? Because a lot of the things that you spoke about, weight gain, poor sleeping habits, snoring, those are all things that typically, the average person, even a woman, would ignore, okay, I just have a snoring problem. So I guess at what age, would you say for a man, do you say, okay, you should start kind of checking in on certain things by the time you hit 25 or 30?
Yeah, I would say, the range I gave you was certainly from 40 to 65. I would say even earlier. I mean, I would say even if I would take it back down to 30 or so, like that. I mean, because if you think about it, if you have a primary care physician, and someone is kind of following these things for you, then again, as you get 30 and above, I think you want to start paying attention to these symptoms. A lot of men, as I said, we delay, and I think part of the reason is women get a direct handoff from pediatrics to gynecology. Your gynecologist either becomes your primary care physician, or they will make sure you get to see a primary care. We don't have that handoff as men. I mean, if you're like me, you finish pediatrics, and then for the next long time, it's a sports physical, right? Which is turn your head, cough, you don't have a hernia, get back out in the field. That's pretty much it. So we wander around, and then that same mentality is the 50-year-old having chest pain, and I'm going to wait it out, tough it out till the morning because I don't want to be involved. But I would say a lot of the men who come into me, they may have a primary care doctor, but they just haven't gone in. I think I can just touch a chord. I have the same type conversations as a primary doctor, but I come at it from a different angle. I have different pain points. But certainly, if you're having those symptoms and let's just as a number, I'll say, over 30, you should go see some, and you can start with your primary doctor. It's just a lot of times with men, when I just talk about this in a way where they're like, well, I can go see him, and I'm like, yeah, because if I find something, I'm not going to treat your high blood pressure, except telling you to get a better life, but I'm going to get you where you need to go, so get taken care of.
Thank you. And then we also had another question come in. So can you please address cultural competency in healthcare as it relates to different ethnic groups?
Sure. Well, that's very important from the standpoint of it doesn't really exactly get on the health literacy component, but it gets on the comfort factor, right? So if you ask me, I've had a number of men who'll come in and they'll say, because I'm an African-American physician, a number of African-American men, they just have a higher comfort level with me. They're like, you know what? I just feel like I can talk to you. And yeah, and some of that is because we have shared backgrounds, and I can joke to them. And so I know that myself, you have to be very careful with other cultures when they come in. You can do certain things that might make somebody uncomfortable. So that's another thing as providers. Some of this you learn, unfortunately, by the school of hard knocks, that you just kind of, you make a mistake and then you change it. But some of it, I think, is just being aware and trying to just learn things. And like I said, with African American men, it's nothing I have to learn. there's a rapport there. But you know, I try and establish a general rapport with all men, with really a common language of health and wellness, and you know, putting things on a very basic level that anybody can identify with.
Well, that is all the time that we have today. I want to first take this time to say thank you, Dr. Billups, for speaking with everyone in regards to men's health and the importance of following up and getting checked up early before later. We really appreciate you being on today and everything that you've done. And for
Well,
anyone
thank you.
and for anyone that is out there watching virtually, if you like to schedule an appointment for a very lucky man in your life, you can call 615-341-4429 to schedule an appointment with Dr. Billups. Again, that number is 615-341-4429. And again, if you have any additional questions, please feel free to continue to comment below or feel free to message at Nashville General on Facebook.
Thanks, everyone, and join us for our next event, which will be Wednesday, June 22nd, same time, same place. Have a great day.